So joining me now is Molly Stevens, and she is the winner of the 2022 MRS Mid-Career Researcher Award. Congratulations, Molly.
Thank you. Thanks so much.
And I know you were having an interesting topic at the lightning talks, designing biomaterials to repair the body and detect diseases earlier. What can you tell us about that?
I'm going to be giving just a really quick summary of our group's research. So we're really interested in designing materials to interact with biology in interesting ways. And we cover both fundamental science, but also through to disease applications. And particularly interested in how we can use biomedical materials innovations to help with new delivery of new therapeutics, characterization of those systems, and also developing biosensing technologies that can be ultra-sensitive and detect diseases earlier.
Now, you talk about integrating assessments with smartphone technology for self-monitoring. How do we balance that?
Yeah, so one of the things I think that's quite interesting, and in fact we reported this in a sort of recent Nature paper, is thinking about how can you make technologies more accessible for everyone around the world, so including in low and middle income countries. And one of the things we looked at in Uganda, for example, was how many people could access technologies via smartphones versus via healthcare centers, and it's you can reach many more people if you can go out into the community, obviously, and have technologies that are cheap enough but also sensitive enough to be read by mobile phones. So the aim really is about democratization of access to healthcare, but of course we work really closely with groups also thinking about the privacy elements, and that is a really important point.
Yeah, I know we talked about the need for confidentiality and but having access to the data about who's being affected. Yeah. So it's a careful balance. Yeah. Where do we see this going forward then?
Well, I mean, we've seen it also in the current pandemic. It's really important to know where people, who's infected, where they are. I mean, maybe not their name, but at least be able to track how diseases are spreading within populations. And so in terms of thinking about the spread of diseases, and we did some work previously looking at Ebola serological surveillance. We published back in 2018, actually before the current pandemic. But, really understanding spread can help you come in with better interventions from a public health safety viewpoint.
Yeah, for sure. And, how soon do you think that some of these innovations will be able to be into the marketplace?
Oh, we have a number of different spin-out companies now that are either set up or being set up for different number of applications. So some of the technologies are, already tested with human samples and patients, and others are more sort of technologies helping in the characterization of technology. So, for example, we've just developed a technology called single particle automated Raman tracking analysis that can essentially help us with understanding the composition of individual nanoparticles. And that's really important for lots of drug delivery applications.
Mm-hmm. Definitely. And this is a Mid-Career Researcher Award. I mean, how do you keep your ideas coming even with many, many years of experience?
Yeah, so I think the mid-career title is kind of interesting. Actually, it's purely defined by age, as you probably know. So I'm still kind of young, even though our group has achieved a lot. Yeah. And so the ideas really come from the whole team, I would say. We have a really open policy to discussing ideas and really encourage creative setting. And so I love being part of that process, but also nurturing all the younger people that go on to do wonderful stuff in our group, but also once they leave our group.
Yeah, wonderful. And no shortage of great ideas coming from the group also.
Oh, yeah.
So appreciate it. Thank you so much, Molly. Nice to meet you.
Thanks so much.